Hey, this is Blake, and I am here to present my community health project looking at homelessness in healthcare, our perceptions and realities facing homeless people. I initially was interested in this because I work in emergency services, where we see about 3% of the homeless population that utilize EMS, fire, law enforcement, and ERs as their primary care providers. And that's okay, except that it detracts from the services that could be provided to people actually having emergencies. And so we have those people that Scrubs and ER and Grey's Anatomy point out as frequent flyers. And these are people that we might see 6 or 7 times in a day per ambulance transport because they know the right words to say, and they're just looking for either attention, resources for mental illness, and sometimes just a place to get out of the cold. And this kind of sparked a larger issue for me as to what is the resources and infrastructure in Fort Collins, and why is it not able to combat that this is a problem. A large perception in Fort Collins is that we are a urban mecca of adventure and outdoor recreation. We have a lot of breweries. Marijuana is legal in Colorado if you're over the age of 21. We have a lot of music. We're very pro-gun in a lot of places, and so it just seems like this outdoor, fun-loving, up-and-growing community. And most of our city council members and local governments want to keep it that way because it brings tourism in, it brings in resources and funding. Yet they turn around and they ignore the fact that we have homeless people that are living in our downtown square, that live down in our parking garages and in parks, and they camp along the rivers, and our police services generally ignore them because they can't ticket them or take them to jail because the jails are overbooked and they're not going to pay their tickets. The city doesn't want to do anything because that means they have to give money to more money to shelters and missions to handle them, who they already think are donated by who already receive donations of extraneous amounts, and generally community members don't want anything to do with it because they would rather just give their money and their resources to the missions and charities so that they can do something. So for me, there was a large discrepancy between what missions and charities actually do in regards to our perceptions of healthcare providers, but also from what the community sees and what the homeless population see. And so I went out and I did some ethnographic research, and I started talking to these people and really just observed the community from each of their standpoints. It was easy coming from medical backgrounds because I could actually go talk to my peers. I had a very intrinsic perception of what homelessness and transient people look like for me, and that's generally the stereotypical war veteran, homeless sign, some kind of handicap that they're trying to claim disability on. This isn't the case. In Colorado, about 38% of the population is actually young families with small children. A percentage of that is minors under the age of 18 that have either been emancipated, living by themselves. This is also the lower middle class, so anyone who makes less than, I think it was $53,987 a year is considered lower middle class, or the working poor. Here is our average income, and it's a much bigger issue than we paint. And so when I started to look into the missions, and I started to ask community members about homelessness, most people said that there's an issue, and it's typically related to alcoholism, substance abuse, illicit drug use. A couple members pointed out mental illness as comorbidities to homelessness and usually attributing causes. On the whole, homeless people are actually quite healthy. They actually have very reasonable standards of health considered in their lifestyle, and they usually have comorbidities that attribute after the fact, whether that's mental illness that develops pre-homelessness and gets worse without treatment, non-compliance with medications, which cause cardiac problems, which cause diabetic issues, which cause neurogenic, so we're looking at seizures, and COPD, chronic obstructive pulmonary disease from smoking and not taking care of your lungs. And so that's something we see on the medical side. For the community, though, they look at it and they say, well, homeless people are generally crazy. This is a perception shared by a large percentage of the community up here, because mental illness is a problem in Fort Collins. It's a problem in northern Colorado, which is another thing we tend to ignore. In Colorado, we have an average suicide rate of 22.1 people per 100,000 community members. The national average is 12.7. So we're almost double the national average. So how does that work, living in such a wonderful, culture-rich place? And so that was another issue for me that was definitely a weasel trail I kind of got sucked into a little bit a couple times. And so over the course of this project, my focus shifted not from just looking at homelessness and health and how that is, but the infrastructures that support healthcare in the community. And so I started looking at low-cost clinics. We have a couple of those in town that serve a majority of the population, of whom are single mothers and Latinos. We also have only a couple missions and a couple shelters that deal with the homeless, and it doesn't seem like it's enough to combat these rising numbers of homeless people here. And so I started talking to the homeless people about what they saw on the ground and what they saw being part of this demographic that sees our culture from the bottom up. And the general perceptions are that there's a couple types of homelessness. There's selective homeless. There's people who choose to be homeless either because they just like having the rover lifestyle. They're also referred to as gypsies here. We do have a lot of street kids that come from very wealthy families and just choose to be simple, so to speak, and it's probably part of that whole hipster thing. And we have disabled homeless, so people who lose their jobs as a result of a disability or an inability to work, and then can't find the federal funding and the grants and the services to find placement and HUD housing because of their disabilities. And then we have people that are suffering from mental illness, substance abuse, alcoholism, which cause them to be homeless because they can't keep jobs, they can't keep with their families, and their families don't want to take care of them. And shelters are no better. When I started to look into shelters and what is entailed there, most of the homeless community said that shelters are actually the places they get sick the most. They might be outside 364 days a year, but that one day out of the year they go to the shelter, they come down with an illness. Shelters pack people in small rooms. They get 2 meals a day. They're very selective about the hours that those meals are afforded to clients. And then charge outrageous rates of operation to the city. One of our missions here says it takes $20,000 a night to stay open for homeless people, and it only serves 200 some homeless people, which on average, according to our local paper, leaves about 238 people during the month of July of last year without a place to stay. And we only have a couple resources like that. Also, property kind of gets moved around a lot with the homeless population. And so that kind of leaves us up a creek because we are their primary source of, emergency services is their primary source of care, both nutritionally and health-wise. Back to that medical perspective, looking at homelessness, there was a huge frustration with how we treat homelessness and how we treat mental health, and that there is a recognition that we don't have the capacities to deal with mental illness in northern Colorado. We have to ship you down to Pueblo, Colorado if you want to get treatment, or down into southern Denver, which is about an hour and a half away at a minimum. We don't have those resources here. Also, our community believes that it's easier just to pay the shelters to do the job that they're not doing. And so our government says, well, our city government turns around and says, well, we are paying money to these shelters to do the job, and our community isn't complaining about homelessness because we choose to ignore it when it is a much bigger issue. And so that definitely doesn't cover everything that my paper did, but I'm out of time. I'm almost at 9 minutes here. And so pretty much the conclusion I came to is that our infrastructure is lacking, which puts a heavier strain on healthcare policy, our healthcare infrastructure, ultimately taxing the homeless population and the homeless shelters that exist, and prevent them from doing an effective job, which in turn breeds frustration and anger from our community members, and in turn our government, which is easier just to ignore the fact that it is a problem and that it exists to the extensive value that it does. So hopefully that makes sense. Hopefully it's concise. I'll attach my paper to this if you guys feel like reading it. It kind of bounces around a little bit because I'm working with a lot of information that grew very quickly over the course of my project. Definitely shoot me a message, shoot me a comment, leave me some feedback. If you like what you see, let me know, and I can definitely get you some resources as well if that's something that you guys are interested in. Thanks for a good semester, and we'll see you guys on the flip side.